All right, I think it should be up. Okay, can you refresh it? I think it should be up. Okay. Hey everyone, my name is Tejpal Bedi. I am a MUA graduated a few years ago. I'm here today just to kind of talk about my experience, answer any questions that you guys have about the application process and everything that goes into this whole stressful time of considering medical school, applying to medical school, and everything that comes with it. So what I'm going to do is I'm going to talk a little bit about myself first, and just kind of go over like my a little bit about myself and my journey. But then whatever questions y'all post, I'll see them on the in this little chat on the left hand side, and I'll address those towards the end of this hour. And I apologize, it took some time to get this thing started up, but here we are ready to go. Okay, so like I said, my name is Tejpal Bedi. I'm originally from Canada, so I did all my schooling in Canada, my you know elementary, high school, and even my undergrad studies was at the University of Waterloo. And towards the end of my bachelor's in science, I was considering, medical school, where to go, and all those kind of things. Um, and at that time, it was after I had written my MCAT, I had reached out to somebody that was already at MUA and kind of asked about their experience and how it's been for them up until, well, I think he was in a second or third semester of basic sciences at that point. And he told me about life on the island in Nevis, the professors that he had, and I guess the quality of education that he was getting, which he was very satisfied with. Um, so that kind of tied into like my needs and what I wanted, and just hearing it from someone that I trusted. I went through with the process of applying to MUA, had an interview, and it ended up getting accepted and starting. Um, so I started my basic sciences on the island, and like I said before, Nevis, a beautiful island. Your first 5 semesters are there, and you start off with the basics of you know physiology and anatomy and all those kind of things, and get more specialized as the semesters go along. With the last semester being more of a comprehensive review of everything that you've learned in order to prepare you for step one. And that whole process is about I want to say like a year and 8 months. And so for me, it was a year and 8 months. Came back towards Canada, studied for a couple of months, and took my step. And yeah, after that whole process, MUA was still in contact with you and with me, and kind of planning next steps. And the next steps after that were clinical rotations. And the one thing, this is probably across all schools, but with MUA in particular, because that's what I'll speak to, with there's a lot of options in regards to where you can do your clinical sites. So clinical rotations. For example, like I was given the option of whether I wanted to focus everything in one area in Chicago, New York, Louisiana, or if I wanted to just kind of start off in one place and go to another place and that kind of thing. And ultimately, I kind of did a mix of both. I did the majority of my rotations in my third year between two hospitals, although I did have the option of going to different hospitals as well. But I was thinking of what's close to home, what's convenient. I don't want to move over and over again, so those kind of things. That's what I took into account. But going into my my fourth year, last year of clinicals, and this is after taking step two CK. Um, I really solidified my interest in psychiatry and started exploring more psychiatry clerkships all across the United States. So, um, starting off in Canada. Canada was my first one actually, in Whitby, Ontario, and I got to see the system from that side, north of the border. And then my following rotations were in Oklahoma, Louisiana. There was one in Baltimore. So I was able to meet a lot of different program directors, see how different programs and how they run things, and ultimately got to meet a lot of different program directors. I think that was really beneficial, networking and all that kind of stuff. So yeah, that whole process was, uh, the time that you really have to like step out of your comfort zone and be like the first person there and the last one to leave and get noticed. And I feel like for me, it worked because I did my rotation in Oklahoma at Griffin Memorial Hospital, and that's where I ended up matching in residency. Uh, so that's a little bit kind of briefly about like how I got to residency. Um, and I'll just talk a little bit about like how residency's been, and how I got to where I'm at right now in fellowship. So residency itself, is challenging, the first year, but then you get like any other first year of university, first year of medical school. There's always a growth curve. Um, Hit that, and afterwards, you get more and more comfortable with what you're doing. Um, Throughout residency, I gained an interest specifically for child psychiatry and applied for fellowship in child psychiatry at the University at Buffalo, and that's where I am right now. Just prior to starting this live, I was just finishing up with my last patient, um, a 5-year-old with ADHD. So you really get. I fortunately throughout this whole experience was able to fall into something, a field that spoke to my interests, spoke to my needs, and I'm finishing my last year of fellowship now, and still have continuous contact with the MUA. I still have, like Joan and had asked me to do this. So, and the reason why I just wanted to kind of give you an honest idea and answer any questions that you may have to improve your chances of not only going through the whole medical school path, but also getting into a residency and a residency of your choice and location and all those kind of things. Um, yeah. So I had a few questions that were already kind of given to me before. Like I got asked once we posted this on Facebook and on Instagram. A few questions were asked, um, but I'll go with what Alexandra has written on the side. And the question is, how many times did it take me to pass comp and step one? So the answer to that question is once and once. So it's for step one particularly, like what I'll say is you want to take it only once, um, especially now when there's the only criteria is pass or fail. So you really want to prepare yourself to the point where you only take it once and you don't have to take it again. Um, in the past, this step was something that separated uh, international medical students from students that studied in the United States. But now it being pass fail, I think is very important that you only sit for it and you take it whenever you are absolutely ready to take the exam. Um, so that's something to also consider. And on that note as well, we used to rely on this step as like the thing that would differentiate like you from somebody else that had trained elsewhere. So like, the step had a lot of emphasis, your step one. Um, I think there's a lot more to it. And I think that plays into like why the score is not as important anymore and why it was essentially removed. It goes into a lot of like who you are outside of the test, who you are like as a person, and that's what's really like kind of looked into. So, networking, being like unique, not like being somebody that you're not, but being like who you are, playing into your strengths, and really, really emphasize, really, really working on that, and trying to be as professional as possible, being the first one there, last one to leave. All these things are very important. um, I remember at MUA they start teaching you this like in your first year, first semester, um, and it continues on in your clinical skills throughout. But once you're doing your rotations, that's you're on your own, and you're kind of exposed to everything, and you have to remember those skills and use them as you go forward. I think that's kind of important and worth mentioning. Dr. Tandon, also a graduate from MUA. Thank you. So, like, just looking at Dr. Tandon's name right there, there's a lot of individuals that I know that have like classmates and all that kind of stuff that are now in very successful and places where they wanted to be when they first started and started thinking about medical school. I talked about the friend that I had spoken to in regards to medical school at MUA when I was considering where to go. He himself, a Canadian, um, was able to go do his residence, went through the whole process, MUA, medical school, residency, and now he's working back home with his wife in Kingston, Ontario. So there's a lot of like opportunity, and it's just kind of sticking to the plan that MUA sets out for you and others, and just kind of sticking to it and being vigilant and being kind of organized and trying to plan ahead for the deadlines that Janet Lawson really helps you with the graduate affairs and all. But um, I can speak to like a lot of people that I know that are now in a position that they were hoping to be in when they started this journey. So yeah. Keep the questions coming, but I'll read off another question that I had written. Somebody wrote it to me yesterday. So the question was, what can I do to be more competitive amongst people from other schools? And I think I spoke about this a little bit. Um, you know, I've said this to a lot of like medical students and like that have applied to the programs that I've been a part of. In my last program, my last year I was the chief resident, and I was part of the interview process, but kind of from the other side. And I would see, what actually kind of gets looked at, and it's not a lot of what I personally thought of when I got into medical school, got into residency, or got into medical school rather. There's like huge emphasis on like, they're going to care about my personal statement. They're going to really care about, my scores, this, that, and the other. But when you're interviewing, a lot of that is already accounted for. You already got the interview, and what really makes a difference is if you are genuine and you show like who you are as a person, you're honest, hardworking, and all those kind of things, and that comes off in a genuine way. It's not like you're trying to manufacture what you're trying to say, but you actually mean what you're saying. If that makes any sense. And that's something that I saw from the other side. The personal statements and all those kind of things are needed. Letters of recommendation and all are needed. Those are actually important, but the thing that stands out the most is your personality. And I might just be saying that because I'm in psychiatry, but actually, I think it goes to other fields as well. Um, yeah, and the kind of coming back to this question, how can you be more competitive amongst other people that are coming from other programs, training from all over the world and all that kind of stuff? There's a lot that you can do, and I think it starts with just asking yourself. Yeah, I think that starts with asking yourself, like, what do you want to do and what do you want to get into? Um, and if you can answer that question in like a genuine way, like I want to get into internal medicine because I love just working with uh, patients with COPD, diabetes, and all, and the hospitalist role really speaks to me. Or I love surgery just because I feel like a different person in the OR, or I love psychiatry because I the therapy aspect and kind of tackling the stigma of something that isn't really spoken about as much as it should be really speaks to me. If you can answer that question before um, kind of planning your fourth year electives, I think is very important because you can kind of tailor whatever you're going to choose to rotate in your fourth year based on the answers to that question. And when it comes to interviews, you're going to get interviews. And when you do interview, you're going to shine in your interview because you're going to be speaking to something that's true within. So that's something that I think would be beneficial, and that would be make you more competitive amongst people from other schools. Um, Question from Medical University of the Americas: can you tell us a little bit more about being chosen as chief resident? What does that mean, and what work does it entail? So the chief role is interesting because you get to see things from a different light. Um, like when you're going through all these different stages of your career. You're a medical student, then you become a resident, and then you see how residency is, right? Like when you're a medical student, you're always wondering, I wonder how it is to be a resident, and then you actually make it there, and then the next step above that is working as an attending, and or going to fellowship. But what the chief role kind of opens a window to is the administrative side of things, seeing how a program is run, and there are some like tasks that are required, like scheduling and all those kind of things. But I think the most beneficial part of it is seeing a part of the program that you otherwise wouldn't be exposed to. And then if you find leadership and kind of leading a team to be something that speaks to you, chief residents and chief fellows, I think that's a really uh, a role that you can really work on those strengths and display those skills. Um, Work wise, it doesn't add much to your workload, to be honest. You do get paid more, but not too much more. But it is something that I feel like you can really reflect on and think of like a lot of experiences that you can continue to use as you proceed further in your career. Another question that I had gotten was talk about how difficult was it as a Canadian going through this system. I think that's a really important question. You know, because there's a lot of, and I think I'll speak to not just Canadians, but everyone that is not a U.S. resident, um, because when it comes towards the match process, there are some things that you have to really keep in mind. And what I'll say is that there's is different, but not that different. Like you have to apply for visas and all that kind of stuff. But a lot of the things get taken care of by the ECFMG. And on top of that, MUA is very aware that a lot of their students are not from the United States. I mean, a lot of them are, but a lot of them aren't. So a lot of people have been through this. They get feedback, and with that feedback, they continue to help out their students going forward. Like for me, when it came to like applying for the visas for once I've matched, the information that I had going into that was provided to me from MUA. It wasn't something that was like foreign to me, but other people, not everyone knew about like what you had to do and all those kind of things. So they really do help you throughout that process as well. Okay. Another question that I had gotten was how was life in Nevis? What kind of change? Like what was that like for you? Um, Nevis. Just to tell you a little bit briefly about the island, it's the population is relatively small compared to it's about 10,000 people. I would say 10, maybe it's more now, 10 to 12,000. Um, it's a beautiful island. You can probably drive around the whole island in a couple of hours, but the main thing is that the school's located in a nice area. There's a lot of places to live, safe places to live around that area. Um, Food is great, but the weather, the beaches, it's a really nice place to do medical school. Um, it does get challenging at times. Like you're away from family, you're away from um, people that you love and all that kind of stuff. But there's a good support system within the school itself on the island with staff and other people as well. So there's it's like your own community within a community within a small community. So it's interesting. Um, I've been meaning to make a trip back because I miss some of the island itself. Um, but like just I guess living there, it's different than living somewhere else like in like dorms for university and stuff because you're on an island. But at the end of the day, you fall into your studies and um, time passes by, and before you know it, a year and 8 months have already flown by. Okay, keep the questions coming. And there's um, another question that I got. Sorry, there's a lot of thunder here. Another question I got in was what's the fellowship process like and applying for fellowship from residency? So what I can speak to is the fellowship that I had applied to, and I can touch on other psychiatry type of fellowships. But generally, um, fellowship it goes through a very similar process like as residency does. You apply through ERS, there's a match, and then you find out where you're going to go afterwards. The timeline's a little bit different, but you're at a point now where you're in a smaller population of people applying, so it could be more or less competitive depending on where you're applying and what specialty you're applying to. For example, in psychiatry, child psychiatry would be considered one of the more competitive fields, but at the end of the day, if you're going to apply to be a child psychiatrist or for a fellowship in child psychiatry, there will be a position for you at the end of that match cycle. But is it the one that you wanted? There's some more competitive ones, but you will get into the fellowship. I know in internal medicine, that's not the case. I know people that applied for rheumatology, cardiology, and all those kind of things. Some of them are more competitive than the others. So um, I think it's specific to what you're applying to and where you're applying as well. Yeah. Okay, so I guess I'm gonna ask what kind of questions would I have had if I was a student um, looking into MUA. I guess things that I would want to know is like, do you feel like you're ready for the step after you were off the island? Um, and so when I mean off the island, after the completion of basic sciences, um, yes, I was. I felt like I was ready, and but also I felt like I needed to refine kind of the knowledge that I had learned. Um, and we spent a couple months doing that to really solidify some of those concepts. But at the end of the day, exam was done and did relatively okay on it. And I think uh, the preparation, the preparation that comes from through MUA and the education and experiences that you get while you're there on the island, I think it's more than satisfactory. And I've heard similar things from my peers as well. All right, we'll keep this open a little bit just to see if there's any other questions that pop up. Okay, so if you guys have any other questions, please um, send them through to the admissions at MUA. They can always pass them on to me, and I can always address them afterwards. Um, I hope this helped. Good luck with everything going forward. Um, yeah, take care.